Hi, I'm KAYLIE MCCALL, a fourth-year Bachelor of Kinesiology student majoring in Human Kinetics at the University of Regina, and this is my special project. The agency I partnered up with for my fieldwork is Gateway Alliance Medical Center. I primarily work with Adam Struby, the physiotherapist here in the gym, but there's also a chiropractor next door, as well as family physicians and a pharmacy team working in the building. So I work here in the gym, usually doing exercise prescription and progressing clients' exercises, making sure they're doing them correctly and that they have proper form, and then if they seem too easy, they're doing great with them, we'll progress them.
Hi there, I'm Adam Struby, I'm the physiotherapist at Gateway Alliance Medical Center. KAYLIE is the first fieldwork student I've taken on. She's done a great job working with clients and guiding them through exercise and making adjustments to their programs. As she's gone through her fieldwork, she's also progressed her skills in taking subjective and objective information and using that knowledge to try to adapt the exercise programs for the patients, and it's going well.
Adam also works for the University of Regina Cougars track team and specifically works and focuses on the endurance athletes. So for my special project, I have decided to conduct the Thomas test and take other hip mobility measurements on the long-distance athletes part of this team. The Thomas test is an effective tool that is used to measure an athlete's hip flexor mobility. This test can either be negative, meaning that the athlete has normal hip mobility range, or it can be positive, and this means that the athlete can either not fully extend their knee or cannot properly bring their knee to the chest. The issue I noted about the Thomas test is that it is very subjective and hard to compare between athletes with just a positive or negative result. So in order to test and confirm the validity of the Thomas test, I also measured each athlete's hip abduction, internal rotation, and external rotation. From here, I was able to look at their deficits and see where they needed a little bit of help. So with the use of Simple Set, which is what we use here at the clinic, I was able to make specialized programs for each of the athletes to follow for a couple of weeks before I retested them. This would just see if they improved and if these exercises were successful, which was also aligned with one of my learning objectives, to look at individuals' deficits and create exercise programs that will help them in the areas they need. My time at Gateway has been truly amazing. Here I've been able to work with populations I never thought I would. In my future professional career as an athletic therapist, I will primarily be working with athletes, which is why I chose to do my special project with the university's track team. This gave me more hands-on experience with the athletes and allowed me to apply the knowledge of my degree in order to create safe exercise prescriptions, which they would then incorporate into their routine in hopes of injury prevention. The athletes involved found extreme value in my project as their hips began to feel better and improved their overall mobility.